Hey, as a certified diabetes educator, one of the favorite questions that I have to ask people who have diabetes is, how's your blood sugar? And equally as favorite is when people will give me an answer, just any number, because if we have a number, it gives us so much information about treatment decisions, about how well you're doing, about what we can do to get you on track. And so that's a good start. So any number makes me happy. Equally as interesting to me is for folks that never check their blood sugar, I always ask them why. A lot of times they say I forgot. Sometimes they say my doctor never asked to see those numbers anyway. Other times they'll say I don't know how to do it, or it hurts, or I don't know what those numbers mean. So today I wanted to clear up a few things with you, and we'll start out by showing you how to do it. If you don't know how to check your sugar, if you don't know how to use your meter, you can always come to Better Health, and either myself or one of the other nurses would be more than happy to show you how to use your meter. All right, so in your kit you get a meter. You should get a lancing device, some lancets, and some strips. Okay. With your strips and your meter, you want to make sure that you're keeping them at room temperature. They need to be kept dry. They don't need to be kept in a cold car or a hot car. You also want to make sure that you're keeping your strips closed up. And with your lancing device, you want to know how to use it before you get started. And you always want to dial it to the lowest number. Now, the highest number is that it sticks you the deepest, and the lowest number sticks you the least amount. So I usually tell people to start out with maybe a 2 or a 3, okay? And the lancet is equally as important. You want to make sure that it's going to work with your lancing device, and most of them are fairly universal, but if you have any questions about that, we'll be glad to help you as well. All right, before we get started, let's talk about how to get your hands ready. The best thing to do is wash them with warm soap and water. You can use an alcohol swab if you're out and about and you don't have access to a sink, or if your hands are really dirty. But actually, warm soap and water does two things. It opens up those little capillaries where we're going to get the blood sample from because of the warm water, and you're also washing your hands. Okay? So you want to start with clean hands. The next thing that you want to do is open up your bottle. You're going to take out a strip. Okay, and close the bottle up, set it aside, and go ahead and stick your strip into your meter. Okay? With this meter, you should see a strip and a drop of blood that come up. That means that it's ready for you. Okay? All meters work a little bit differently, but most of them, when you stick the strip in, it turns it on, and when you pull the strip out, it turns it back off. Also, when you stick the strip in, say I got ready to check my sugar, my phone rang, somebody came to the door, I left the strip in, I set it down. After about 2 minutes, your meter shuts off automatically, so that's a battery saver for it, okay? All right, so my strip is in. Because I've been gabbing a little bit, I'm going to pull the strip back out and put the strip back in, so we have a full couple of minutes for me to show you about sticking your finger and how to get a good blood sample, okay? Now, if I'm somebody who's particularly hard to stick, then I want to go ahead and shake my hand, because that gets a lot of the blood flow going back down there into my hand. Okay? The next thing is that I want to make sure that I'm using all 10 of my fingers. All right? Making sure that I know that I'm alternating my fingers, not just sticking one poor old finger all the time. The other thing is that a lot of the nerve endings in our fingers are in the center. So you should never stick the center of your finger or let anybody else do so. You want to stick the sides of your finger, okay, because we have less nerve endings there. And for those of you who say you don't stick yourself because it hurts, this is a good way to minimize how much it hurts, okay? So I'm not at a sink, so I'm going to go ahead and clean my finger off, okay, with an alcohol swab. I can wave my hand around if I want, but what I don't want to do is blow on my finger, because then I'm taking all the germs from my mouth, back of my throat, and blowing them onto my finger, which I don't want to do. Okay, my lancing device is such as this. I want to go ahead and stick my lancet into it, okay, and I'm going to twist the end of it off, and I am going to go ahead and put it back on there and dial it to 2. All right, it should be ready for me. If I accidentally click it and I don't stick myself with it, then with this particular one, I can recock it. Okay? All right. So I'm ready. I'm going to stick the side of this finger. Okay? And what I'm going to do then is I'm not going to just pinch the end. I'm going to start up here. I'm going to get myself a good blood drop. I'm going to wipe that one off in case it has some soap or water or residual alcohol on there from washing my hands. Then I'm going to get myself another good drop of blood. I am going to put the drop of blood on my meter, and I'm going to take my tissue. I'm going to put it on there so that my finger quits bleeding. All right? It says my sugar is 91, so that's a good blood sugar. Now remember that with the trash that I've made here, I can throw that in the trash. I can take my strip out. I can throw that in the trash. My machine will cut off. I'm going to pull my lancet out of here, and I'm going to stick it in my Sharps container. Now, you don't have to have a Sharps container. You can use a detergent bottle, a coffee can, a drink bottle, just something so that you can put that Sharp in there so that someone else doesn't get stuck on that if they're emptying the trash. Okay, so we want to, that's a safety thing. All right, so that didn't hurt at all. All right, I stuck the side of my finger. I'm working on it to get it to quit bleeding. Okay, so that's how to do it. That's hopefully how to minimize the pain. What do the numbers mean? The American Diabetes Association numbers say 80 to 130 fasting. That means first thing in the morning or before meals. All right? And then 2 hours after your meal, it should be less than 180. So when we say 2 hours after a meal, it's 2 hours after the beginning of the meal. So if you pick up your fork to eat your supper at 5 o'clock, by 7 o'clock, your sugar should be less than 180. Okay? What do I do with my numbers? I want to write them down in case I accidentally drop my meter in the toilet or in a cup of coffee. That way I have my numbers so that I can take them to the doctor. But even if the doctor doesn't want to look at them, it's my information. I'm the person that is in charge of my diabetes. I'm the person that is making decisions based on what my blood sugars are. I'm making decisions about what to eat, my activity level, the medications that I'm taking, the stress that I'm under. So lots of decisions to make, and this gives you some great information to know how your treatment is going. Say I stick my finger first thing in the morning and my sugar is 65. I know that that sugar is too low. 70 and below is too low. I need to give myself some fast-acting carbohydrate, 4 ounces of juice, 4 ounces of soda, 3 to 4 glucose tablets, whatever I have on hand, some honey, some pancake syrup, peppermint candies, so I can get my blood sugar up. Once I check it, once I take my 15 grams of my fast-acting carbohydrate from the list that I just spoke of, then 15 minutes later, I want to check my sugar again, and hopefully it is between that 80 to 130 at that point, okay? Sometimes doctors have different goals for you based on other things that are wrong with you or your age. You want to always go first with what your doctor says as far as where your numbers should be. Okay, American Diabetes Association again, 80 to 130, fasting and before meals, less than 180, 2 hours after a meal. If your doctor has different goals for you, that's what you want to go with, okay? What about I forget? Well, it's good to try to work it into your routine, just like you should take your medication at about the same time every single day. You should always check your sugar at some routine times too, okay? So we all get up, whether we get up in the morning or we get up at night, we all get up. So you want to go ahead and try to get it into a routine that you're checking your sugar at least sometimes first thing in the morning. Unless your doctor tells you to check it every single morning, you want to work fasting blood sugar into your routine. Other times that you can check your sugar at bedtime, before meals, before activity, after activity, just to see what a new exercise regimen does to it. You can also really tell a lot about how a certain food affects you and your blood sugar if you'll check your blood sugar. Some people can eat rice and it doesn't make them have a really big glucose or sugar spike, and some people can eat rice and it makes their blood sugar jump over the moon. So it helps you be able to make decisions about what to eat, your portion sizes. Remember, it's your information. Sometimes